All right, we're back again for some more release. Last week I told you we were gonna keep working on this headache and shoulder tension. Then here we are. If you are subject to some headache or tension behind the neck, all along here and going down the spine to the middle of your spine beneath your shoulder blades, please stick around. If you have tension between your shoulder blades, you cannot get rid of it, I would highly recommend you to stick around and watch this release. Besides that, I would highly recommend you to click on this video before you do this release to get started with, in order to reduce the work of the back line of the body, because this is how I work using fascia line. Let's get started. Now I'm going to explain you how to release it with this ball, but also we're going to use the big ball. Two different positions. First position will be against the wall. Second position will be on the ground. What we're going to do for this release. With a small ball for the rhomboid muscle, I want you to go from this lower part and go up, and then a little bit on the side, go down, and a bit on the side and go up. The objective for you is gradually from the spine towards the inner side of the scapula here. Afterwards, for the lower trapezius, the technique we're going to use is like a stairs. So we're going to go up a bit and down on the edge, up a bit and left on the edge. Now I'm going to show you right now. If I want to release my right, I hold the ball with my left. I set myself up, I get the ball closer here, close to the spine, and then I look for a sweet spot. I go down a bit. Yes, I have a sweet spot here. What is important, I don't want you to roll, because the muscle, it takes time for the muscle to be released and to rehydrate the muscle. So take it easy. Once you find the spot, you stay on it. This is for the rhomboids. Then afterwards, for the lower trapezius, I go as low as here, and then like I told you, I'm going to do the stairs. So I move the ball up, and then I go a little bit on the edge. Yes, up and on the edge right here. I have a nice spot. I'm going to do the same as well. Try to lift my arm, go down. When I change, I go up a little bit on the edge. If I slip, I will feel like the muscle, boop, I've just passed it. So I go back on it. This is what you want to feel. This lower trapezius, what it can sometimes do, it can radiate the pain up to, again, the top part of your trapezius. This is where this area can get a bit confusing when it's about pain management. Try to do the release as well, but on the floor. You can use the bigger ball to make it easier for you. The way you set up yourself is you lay down completely, get the ball to roll right here, start the same point, and then I do grab my head here, and I just go down a bit. And the same, if you want to do rhomboid, you go up and push more and more and more the scapula away from the spine. And then you can also do the same for the lower trapezius, starting close to the spine, up a bit on the edge, yes, up a bit on the edge, up and a bit on the edge. This is painful but also pleasurable. Keep it up. Now always remember, like I told you before, feel your body before, feel how your shoulders are moving, feel how your neck, your head is moving before and after the release, so that you can, whenever you feel the tension or the pain, remember, oh, this is what I'm feeling now. This is what James showed me to do with the lacrosse ball or the bigger ball. Always do a before and after to compare, to just increase your information about your body in your dictionary of your body, something like that. If this video was helpful, don't forget to subscribe and like the video and start using the proper mechanic for the body. Until then, keep it up.